Go. Okay, guys, welcome to the first episode of the Hot Pulp podcast. I'm Dr. Jabir Kazi, and I'm joined by Nat Bradley today. We're at uni together. She's a couple of years above me, and she's doing some great work with homeless dentistry and providing them with a really good service. So, hi, Nat.
Hi, thanks for having me.
Brilliant. So, we're going to start off just talking a little bit about why you decided to start with dentistry in the first place. What got you interested kind of before uni when you were younger? What made you choose as a profession?
I first wanted to be a dentist after my dentist told me I needed a root canal treatment, and I just admitted that live with how many people are viewing now. How embarrassing. I never actually had a root canal treatment done myself, though. Touch wood. But he explained to me what the process was, and I went up and read about it, and I thought, oh, that looks quite, sounds quite interesting. So that kind of inspired me to get some work experience at a local dentist, and he was a really nice chap, really passionate about what he did. I went there every week for about a year to experience what went on day to day in his practice, and that really inspired me to apply. I like the mix that you're providing healthcare for somebody, building up a personal relationship with patients, which through from when they're children to that's what got me in initially. Was I can see people grow up around me and how they develop, and I can also do some hands-on treatment. I at the time thought there would be nothing worse than sitting in front of in the computer office day to day. So the practical element of the job really inspired me. And also, when I was younger, I thought I wanted to do something sciencey, but I don't want to work in a hospital. Which is ironic now, because that's all I work. I work in a hospital. It's funny how things develop. But that's what really attracts me, essentially the flexibility of where you could work as well, and when you could work.
So was that like you kind of similar to a lot of people? I think really quite good at sciences and maths and that sort of a thing, and then decided, I don't really like the idea of maybe medicine, because I thought I don't want to become a GP. Essentially, that put me off, and then I went towards dentistry, obviously, because I can cut things up and make things look nice, etc.
I do it. You diagnose, you treat, you monitor, you can see the outcome of the treatment that you do. So yeah, definitely.
Kind of more you get that visual outcome going. Yeah, it looks really nice now, and then obviously there's less risk of people dying and stuff like that. So
got this thing pretty bad to kill somebody, isn't it?
yeah, you've got to really screw up. What was that kind of first moment that you were like, oh, right, this is definitely for me? Because obviously you have that initial, this might be it, but you may be thinking of other things. What kind of other things do you have in mind as well?
To be honest, I was on a pretty one-track mind. When I was about 16, I was like, yeah, I want to be a dentist. When I was younger, I used to want to be a vet. I love animals, and I used to watch all the programmes, all Dave Nasser, biggest fan. But I realised after we picked up a cat on the side of the road when we were younger and taking it to the vet and it had to be put down, I was distraught for weeks. I don't think I had the resilience and to be able to deal with animals dying on me. And the fact that I'm also allergic to cats was kind of a bit of a big hurdle as well. But dentistry, when I was shadowing the dentist, I shadowed for a long period of time. One week he decided that he set up some teeth for me and some plaster, and gave me the drill and was like, this is how you cut a cavity. I went a bit crazy, like the biggest cavities I've probably ever cut, but I was like, this is really fun.
I think that was the same in first year. They first week of dental school, they sent us up onto the clinical simulation lab and then just handed you everything. Said, go to town on these teeth. They had set up, and everyone was just whipping things off the root first and all sorts. I remember that.
Going crazy.
Yeah, so you didn't really go for vets. You've got a rabbit, haven't you?
I've got 3 rabbits. Yeah.
3. Right.
Yeah.
What are their names?
They are Justice, Goenka, and Kiwi. So people think, you should link the names together like Flopsy, Mopsy, and Cottontail. But when we got them, I was living with my boyfriend and his younger brother, and so we decided to name one rabbit each. So each one's got I've named mine Kiwi. So I thought that a piece of fruit is a good name for a rabbit, and he's all black, so he's a Kiwi. Yeah, good joke. And then the other 2 named theirs, one after a yoga retreat So basically we got the rabbits as a surprise for my boyfriend. He went away for 10 days on a silent meditation retreat, and then when he came back, we had 3 bunny rabbits. So he had to name it after the retreat.
Did he enjoy the surprise, or was he like taken aback?
He really liked it. We basically, before we went, he floated the idea, and we like shot him down, saying, it's not a good idea to have rabbits. We can look after them, blah, blah, blah. And then when he was very like, actually, yeah, we can work this out. Let's just get them. And yeah, I'm so glad we got them. Having animals, like having pets, is just. I've never had a pet more than a goldfish before, so as you know, I really enjoy coming home to have 3 fluffy balls there waiting for me. Do you have any pets?
We have one little cat called Zum Zum, which I'm sure everyone's seen on my Instagram every now and then. Yeah. So yeah, definitely. So you probably wouldn't want to come around if you've been allergic.
No, that's take some antihistamines. Maybe a bunny rabbits and your cat can be friends.
Yeah. So you moved away from the vet side, and you obviously went towards dentistry. And obviously, you go through the A-level point where you're thinking, right, I've got to get these A's, and did you have a backup option in mind if you didn't make it? Like, I was thinking about architecture really randomly, but obviously you've got to have like a little bit something in the back of your mind if this doesn't go to plan. Or you one of those who's just like, it's happening no matter what?
Well, at first I was like, yeah, it's happening. I'm definitely gonna get in. And then 3 rejections later, I was like, oh God, I need to think of a plan B. So on a whim, I just put as a backup option of ophthalmology. Like, yeah, that'll be fine. But yeah, thankfully I got
it's
one.
Close to the teeth, just a little bit.
Yeah, exactly. Still kind of related, just another body part.
Yeah. So how have you kind of found it since, from what you thought, when you went into work experience and then actually working as a dentist now? Have you found that it was the same as what you expected or different? Obviously, you've moved into a homeless side of things and, community sort of dentistry, which is maybe different to what a lot of people are doing. Is that kind of what you expected to end up doing, or how's it been?
No, I did not expect to end up where I've ended up. I think most people's perceptions as they go in as a young dental student is, I'm going to be my dentist, because most people's experience of dentistry is what they've seen at their dentist or their orthodontist. Like, how many dentists have had ortho? Like most people have. So at Newcastle, we didn't really get much experience of community. We had outreach, but it wasn't really special care in the way that I see special care now. And it's just through my basically where I've ended up that's kind of, and with mentors that I've had who've inspired me through the way have got me to where I am now. But yeah, I remember doing my first year in practice and thinking, like, I got to your stage and was like, okay, I'll do a year in hospital just to see what it's like. Then I'll go back to practice. I haven't been back to practice since. It's just you never know what hooks you in and what really interests you and what your skills are. And I feel like being in a hospital environment or a community environment where you see, I really enjoy thinking outside the box in terms of this patient's got this problem, but they've also, how do we get them to manage their dental treatment if they've got a learning disability or if they're really, really anxious? How can I adapt the way that I've normally worked so that person can get the treatment they need? So I like that lateral thinking and problem solving, and I don't think I'd give that up to go back to the day-to-days of everyday practice.
Kind of more of a holistic approach to things, and you've got to think about how it's going to fit into their life, and for some people it's quite a difficult movement to make for them if they're learning difficulties and might not be able to hold a brush properly, how we're going to manage that sort of thing.
Exactly, yeah. And actually the dental treatment is just a small part of the picture of this patient, and it's not the treatment that really they're grateful for. It's the time that you take to listen to them and their needs and addressing to what needs they have and what adaptations they may need, from just giving them a bit extra time to being able to treat them in their wheelchair, to be able to offer them some sedation. And it's just being able to be that problem solver and lateral thinker, and the patients are really, really grateful.
So if you've got like someone who's come in maybe with the homeless side of things, what do you find is their main issue outside of the dental thing that's kind of limiting them? Obviously they need to have a firm place to live and a dress and all that sort of thing. Is that usually the biggest thing for them, or is it other things as well?
I mean, it really depends. Like, we have a perception of what a homeless person might be or may look like or what they might what concerns they may have. But there's such a big spectrum of homelessness. It could be someone who's literally just got nowhere to sleep and sleeping on the streets.
Yeah.
It could be someone who's, you know, sleeping on their sister's couch and has been doing that for the past 6 months because they can't get get the money to get a house deposit because they're on a 0 hours contract. So it really, really depends on it, and wouldn't want to paint everyone with the same brush. There might be people who just are in so much pain from their teeth or from other problems that they are self-medicating with drugs and alcohol, and that's their motivation, is to get their fix so they're no longer in pain, or they've got such severe mental problems, and that's they're so unpredictable, they're chaotic, and their needs change from day to day depending on what their mental health status is at, or whether they've been able to get a good night's sleep somewhere or been able to get a hot meal. So it really, really varies, and it's when I treat these patients, it's just listening to them, being non-judgmental and being flexible and listening to their needs. And going on about them about, you haven't brushed your teeth today. Like,
it's different to someone who's, it's different to the kind of patients we see in general practice, so where they've got something else which is much bigger, which is the issue. But do you kind of find that once you sort maybe the pain out, that then the drugs and alcohol drops as well? Because if that's their clutch?
Yeah, definitely. So I've seen people who literally, they've not been able to access any care because they're in so much pain, and has made them dependent on their drug and alcohol problems, be able to self-medicate and function. And you see something as simple as taking a tooth out for them, and you see them a few weeks later and they look much more well. Or patients who self-esteem is really, really low because they are homeless, but also they might be because they've got no teeth. There's people with homelessness are much more likely to have missing teeth because we either take them out when they have a problem, because that's the only thing we offer them, or they're knocked out when they have trauma from falling when they're drunk, or when they get in a fight or someone assaults them. So I saw a chap who just needed some new dentures made for him, and I made him some new dentures in a very, quite swift manner to make sure that I could get them to him. And then he saw me the following week, and he said he got a job as a kitchen porter, and he said he would never gone to that interview with his old set of dentures because they were dropping and they didn't look good, and then he now had the confidence to interview, and then he had a job, and that's the first step to help him get out the cycle of homelessness. So it's really, really important, and dentistry is really important for this group of patients.
Yeah, I'm sure that a lot of kind of, especially foundation dentists in the UK, where we see quite a lot of maybe exempt patients with a lot of things going wrong, have maybe a story like you give someone a denture to fill some anterior gaps, and eventually they, when they come back for a review, they say, oh yeah, I went out and bought some new clothes that same day. That kind of a change in their attitude and how they're living their life, and just, showing the teeth at the top instead of sucking over, kind of hiding things. Moving like slightly sideways back towards dental school, how did you kind of find Newcastle? Because it's quite a interesting student city to kind of be in.
Yeah, I loved Newcastle. I kind of got as far away from my parents as possible. We lived in Dover at the time, so there was no option to like go home for for the weekend or something. But I didn't want to. I loved being independent. I loved Newcastle, such a friendly city, small enough that you got to know it really well. The university itself, I thought it was a great place a great community. The way that events would run, we get to know each other, like how we know each other, like from social events, from mentoring schemes, that everyone would get together and you'd know people in other years to be able to help you if you're struggling with a particular essay, or struggling with the clinical skill. I think that was really useful. Did you think the same?
Yeah, I found that with, the dental school being such a small, quite small, tight-knit community, everyone's in the same building. You might know people 4 years above you and they go, oh, watch out for this when you get into clinics and that side of things. And those are people you're still talking to now. And they're 4 years, 5 years ahead of you going, do this course, do that course, don't bother with this one, do that one. And similarly with kind of clinicians who taught us, I still speak to a couple, and I'll send them cases and asking opinions. Chris O'Connor's a great one for that. He'll send you an essay back and a video of how to do something if you really need it. So thanks to him if he's watching. Yeah. So yeah, Newcastle was a great city to be in, especially certainly as a dental student.
Yeah.
What's kind of your best memories from uni as it was in the dental
Um,
school?
so many. Um, every other Friday night at the Crown Bridge. That's always a good memory.
Yeah.
Um, just the events that were put on, like Hustings, that was my favourite event in Newcastle. So we're all getting together, voting for the next president, but watching the videos. I remember when I had to make when I ran for president, having to make that video. That was probably quite stressful. One of the most stressful parts of actually dental school was making that video. Especially because I lost half the footage like 2 weeks after starting to film it.
That video takes over the entire dental school for about 2 months. Everyone's
Yeah.
involved, and you don't get any work done. There's people going, "Oh, do you mind coming across?" And we're just gonna like walk through the park and do this or do that, and it's really crazy. And there's people like hiding behind the columns, doing little jazz hands coming out, and as someone walks past.
Just asking all the staff and tutors, like, please, will you be in my video?
Yeah,
please?
will you say this slightly inappropriate remark, and it won't be bad, I promise. That sort of thing is great. Obviously, you've got loads and loads of good memories from uni, but what was kind of the low point? If you don't mind me asking, like, what was your worst point in time? Thought, oh, this isn't for me, maybe, or just like, oh, I can't be bothered anymore. Because everyone goes through that. Oh, I'm really loving it, and then they go through, oh, I just can't be bothered. So kind of what hit you?
I think it was during second year, like the excitement and buzz from being first year at uni to the transition to being actually second year was a lot of work, I remember.
Yeah.
And it was all work that at the time we don't see the relevance of, because it's all like dental materials or what else did we learn? Embryology and histology. And, looking back on it, it kind of makes sense now once you start doing the clinical work and the day-to-day stuff that you do. But when you're at that stage at uni, I don't think a lot of people, we didn't really see the relevance of it.
No, yeah. I can't
really
remember.
didn't enjoy that at all.
That was an exam that I really struggled to get my motivation to work for. And I did retake that one, so that kind of shows. Because there was a lot of like embryology and things that they're looking at slides going, okay, but don't I just like cut this and put crown on it?
Yeah, exactly.
in the back of your head going, why am I doing this? But I suppose when you get to see kind of people who've got more advanced and syndromic sort of issues, you can work out where it's come from and at what stage that began. For even things like MIH, during 6 months of pregnancy, 9 months of pregnancy, and then the 6 kind of months after, that could have been when it started. Were they ill at that time? That kind of thing.
Yeah.
But yeah, what's your big tip for someone starting university now then?
I think it's just make the most of every opportunity that you get through uni, but try and stay a bit grounded as well. Like, it's so easy to get in the hype of uni life, and this is what I should be doing. Like, I should be spending my summer holidays in Thailand, or whatever is the craze or the cult at the time that you're at uni. But you don't always. That might not be for you. It might not be possible for you, but it's fine if you that's not your situation. Just take advantage of opportunities that come your way, and you will learn something from it. I remember between third and fourth year, I didn't go home for the summer. I stayed in Newcastle by myself in my house. I had no money, so I worked that whole time during in summer, living by myself.
Yeah.
And where you have a lot of your friends going home or going travelling for 6 weeks, whereas I couldn't afford to do that. But actually, I think I learned a lot during that time, just being by myself and living with myself, and getting a routine and being able to function and look after myself. And being independent, I think I learned so much, and I think everyone should have the opportunity just to be by themselves for a bit and live by themselves, just to be comfortable by yourself. I think that's
kind
really
of knowing your own limits. Is that kind of where you're going? Like, some people are maybe got parents who can fund certain things, or they've worked beforehand and they're in a different stage. That's kind of what you're saying, isn't it? So just to make sure you don't put yourself out a bit too much.
Yeah, exactly. What's your situation? Everyone's different.
Yeah. On a more in the dental school side of things, what would you be telling dental students to do or not do? What do you reckon?
Get as much clinical experience as possible. I remember, like on oral surgery clinics when you've got, all 8 of you sitting there, and the tutor comes in going, first one's from hip and deck or ABC or everyone from the who's going to see it, and everyone's like, I don't want to take it. But actually, you are as a student, yes, it's daunting, but you are in such a sheltered environment. You've got so much support. Imagine being out in practice. You have a foundation trainer. You know that you don't have as much support there, and all the facilities and equipment and skills that a lot of your tutors have. So just I think maximise your clinical experience, do extra clinics if you've got time and you have the opportunity to, get as many patients in as possible, see as many of those emergencies as you can, try and do as many distractions as possible. The thing that we hear all the time, isn't it? People coming out of dentistry school without as much experience as what people expect them to have. And I think it's different. We can't compare generations 20 years ago to generation qualifying today. Like, people don't need full dentists anymore, or very small amount of cohort people do. But if you expose yourself to like consultant clinics, shadowing, different experiences in dentistry. So I think I would have done more like outreach work. I always encourage all the students in our special care clinic to go and contact community clinics and go, just spend a day shadowing. You learn so much out in kind of the day, and outside of a dental hospital as well. Like, the environment of dental hospital is so different to practice or community.
Definitely. I think that's definitely something people should kind of keep an eye on. Maybe make a tally. If I go back, I will probably make a Excel sheet. I've done this many endos, this many caries managements, and then just say, I'm a bit low there. Do I know enough? That's probably what I would do, because I came out maybe not having done as much caries management as possible. My endpoints were a bit spotty to start with, and I was like having to get a lot of check-in by the supervisor just to say, right, is this where you would stop? Is this where you would continue? But that's the kind of thing where, if you've just been a little bit more on top of it in uni, then you might come out with just another extra bit of experience to get you along the way.
Yeah, exactly.
We've got a question from Mudcakes. It's so hard to get extra experience now as year keeps getting much bigger and resources more scarce. So that's definitely an issue. Also thinking about kind of, if you look back in the notes for some of the patients we had in uni, and then you go back to like 89, you just can see what they did back then, and they put one line as a notes, and now we're doing up 2 pages. So there's a big difference. So you do need to kind of bear that in mind, I think.
Yeah, and I guess it's different. Dental schools will be different. You'll have big dental schools like King's, where you've got so many people in a year. I agree, it's really difficult to get that one-on-one. It's like relationship with your tutors, or be able to get these more experiences. Whereas you have some of the other dental schools which are much smaller, where they can really cater to your needs. I guess it's just being able to identify them yourself and having that one person who's a good mentor for you, and being able to be flexible about how you might gain the experience. So maybe not just depending on everything that you get through dental school, but reaching out to the community to shadow, spending good time in your elective, doing different things. There's lots of endless opportunities out there as a student. Most people are quite welcoming to having someone shadow them. I certainly am.
Yeah. I suppose there's certain people who you just want that extra person in there to chat to whilst we're going along. I know that during my foundation year, when TPD came in, it was great because obviously the patient sat there with the mouth open. I think I had rubber dam on. And it's like, I'm quite bored. The nurses there just rushing around. It's like, so Mark, what are you doing then? How's things going? It kind of just brightened the day up. So yeah, if you are looking to do dentistry, but definitely just get in touch with people. And there are people out there who will want to see you and kind of show you the way things are going and that kind of thing. What was your big challenge kind of after dental school? Because obviously you've done quite a few different things, kind of dipped your toe in a couple of different ponds, as it were. What was the big challenge, you reckon?
I think the challenge for me has been managing a balance between work and your own personal life and your personal goals and your career goals. I'm a very yes person. I will be like, yeah, I'll do that. Yeah, I'll stand for that role, or yeah, I'll write an article, or yeah, I'll do this. But I guess it comes to a point where you're going to have to say no to things because you just don't have, you're not superhuman, and you don't have capacity to be able to do everything, as well as your own, without it overtaking your personal life and your personal goals. So I think that's been the challenge for me because being in the city in London and with the connections I've been able to get through my different roles, it's there's lots of things going on all the time that we can get involved with. It's just prioritising which ones fit with your personal goals and your career goals, and actually will make it so you don't get burnt out. Which I think is, we hear about much more. Mental health is a real problem. Not just within dentistry and medicine and other healthcare professionals generally, and we need to talk about it more. And I think just what the expectations of what we see on things like social media don't really help us. So we just need to be managing that and recognising that and reflecting on what stage and what your own mental health is like. I think everyone should take that time to be able to do that.
Definitely. Especially, there's definitely a big stresses, especially in the dental kind of environment. If you're working in practice, you've got the UDA pressure if you've taken on a bit too much or you're not quite at that stage. And if you're looking at more hospital, what are kind of the pressures there that you need to be aware of, do you think?
I think it can sometimes you get involved in the politics working in institutes, and it's not just within like dentists, but dental nurses, the whole hospital itself, and getting frustrated with policies, bureaucracy, and red tape, which can really frustrate you. Anyone who works in the NHS or a big organisation or corporate or whatever might get frustrated about seeing how things work and think, why is it done that way? And the answer usually is, we've always done it that way, which isn't a good answer. It's just an excuse. And I think that it can be really demoralising sometimes if you work within a group of people who kind of have that attitude. So I think it's just, not letting that tarnish what you want to do and how you want to make change, and that actually that any member of the team can be innovative and find changes and make the difference to make the service or wherever you work more efficient and actually have better patient outcomes ultimately.
I kind of always think of it myself as like maybe writing things down on a big piece of paper, A4 piece of paper, draw 2 circles, things I can control, things I can't, and work within that box and then ignore everything else. I think that really helps me, because then I know that I can take photographs of my work and then put it up on the big screen when I get home and go, oh, that's good, that's bad, what should I do next time? Whereas if a patient doesn't turn up, there's nothing I can do about that. I don't need to stress about that. There's things that you can and can't control. So I think that's a good maybe tip for other people who are kind of wanting to manage stress, that there's things you can't control, get on top of the things you can and kind of leave the rest to other people.
That's a good tip.
So what's your kind of method for improving your kind of quality of your work in that way? What do you reckon?
I think it's time. Well, a lot of dentists coming through are very used to reflecting on things. We have a very formal way of reflecting our progress through our portfolios. I don't think anyone has to rely on a specific portfolio to be able to do that. You can do that within your own personal space or your personal portfolio. But I think it's important to be able to reflect on what you've done and what could be done better, or problems you encounter and how you might be able to make a change and learn from an experience or an encounter. Having, I think, really a really good person to bounce off is really important. A really good mentor to be able to be like, this happened, what would you have done, what could I have done better, or even just something simply as that, I'm really struggling commuting, how do you manage it, what do you do to help with your an hour and a half commute every day, and I think sometimes it's just working out what to do with time that we otherwise spend scrolling through Instagram, and making good use of our time. I mean, that's fine in moderation, but I think it's our autopilot of doing things of what do we do if we're slightly bored, straight onto your device. And I've been trying to do things like make more use of commuting time so that I can, might just be I read a book. It might be, I'm going to catch up on my social media during my commute, and that's it. That's all I'm going to do. for social media that day, or I'm going to read through my emails before I get to work because then I'm more productive. But then I know that I'm not going to have a look at my phone and like within an hour before bed, because otherwise that stress me out. But just working out things that really make you more stressed, like you say, and if you can control a change, make that change.
Yeah, definitely. Those good kind of points to pick up on there, and especially when you're talking about stress, how do you take yourself out of it? I know you've got quite a few hobbies. You've got the bunnies. You've got different things going on. What's your biggest kind of stress relievers, as it were?
Bunny, pets, animal therapy. Yeah, no, that's definitely a way forward. But I sometimes just I have we have this little box at home. It's like a time box. I don't know. I think it's designed for people who were binging on food or wanted to control their their sweet tooth habits. But basically, it's a box, and you put a timer on it, and you can't open the box again until that time's finished. So we bought that initially, so we put our phones in it. So they were like, going to have 2 hours, no phone time. And it didn't always go to plan. For example, when the Morrison's delivery man was trying to call me and I couldn't answer the phone because it was in the box. But it's always quite a fun anecdotal story to tell. But I think whatever what you find finds you to not think about work. So this year has been a new change for me. For the past few years, I've always worked at the weekend, and in September I haven't really officially worked at the weekend. I mean, occasionally I go and do a course, like lecture of a course or something, but not regularly. And so I really dedicated my weekends to I'm not going to think about work, not until Sunday evening.
Just keep it. Yeah. Go off and do things. So, is it you're doing dodgeball? Is that right?
Yes, yeah. I really enjoyed dodgeball until I broke my fingers doing it. That wasn't exactly the best for my clinical work time. And then did. So it's fine.
Yeah, so that's quite useful. You're trying to teach yourself languages. I think you mentioned that to me once as well. So what's going on there?
I've always been someone to I feel so ashamed that I don't speak any other language apart from English. And then when you speak to a non-English speaker, they're like, "Oh, it's fine, you speak English. You don't need to speak anything else." But I really, really want to be able to speak something else. But I never get beyond like first beginner course of did Mandarin. So I guess that's not the easiest language to just pick up.
Straight in the deep end there.
Exactly. It's like learning like 3 languages at once. But I really like Asia, and I've been, traveling around Asia before. My boyfriend used to live in Hong Kong, so I was really motivated that period of time to learn it. But when you don't practice it, it just goes from your head really quickly.
Yeah.
And then I did a British Sign Language course, which I really enjoyed, and I actually do use some of that sometimes when I see some of my patients.
That's
but not to do that. I see to be a British Sign Language interpreter is really, really hard, and you can see why. Like, they're just so quick, and I'm like, hang on, slow down, I can barely just spell my name.
Yeah,
it's so useful. People appreciate it when you try and communicate that way.
Yeah. So, what's your kind of plan going forward for the future within the profession? Like, well, where do you see yourself in maybe 5 years and then 10 years?
Well, hopefully I'll pass my specialist exams. So I've still got at least another 2 years of my special care registrar training to go. And I always see myself as not kind of doing the same job 5 days a week. I think I'd get very bored very quickly if I did that. So like for the past year, I'm basically somewhere different every day, which I really like at the moment. Maybe when I have a family, that might not be so practical. So as a special care dentist, a lot. While I work in hospital now, a lot of the specialties is delivered in community. So you might see my split time between community and hospital. One of my big career goals, really, I'd love to do is a process of trying to do set up a social enterprise so I can run a service myself. Because I can see how it's such an area of need for the patients that I see.
Yeah.
People who are homeless, people who are vulnerable migrants or travellers. Like, there's literally nothing out there, or very little services out there.
Quite a growing population as well of people who are unable to kind of reach care efficiently as well.
Exactly, and they present really, really late, and outcomes are much, much worse for those groups of patients that really need specific delivered service for them. And the rhetoric is, oh, these patients have no special care need, they can go see a general dentist. But there's so many barriers there for them, and the stigma around for them. And general dentists actually probably aren't the best place for the majority of these patients. When general dentists, you get a DNA, you don't get paid. You've got the practice to run, and they're so chaotic with the way that they approach things. They don't fit into what the rest of your patient cohort is. So, you may not have the skills or competence to treat them. And it might not be financially viable for you to treat these patients. So I think having the specific understanding and trust in a service that's specifically designed for them, whatever the population might be, it's something that really needs to be targeted, and that's something I really want to champion.
Yeah. So you kind of get involved with like dental leadership a little bit, haven't you? Just to kind of push things out there, and obviously you're doing the tooth germ. So how does that all tie in? You reckon?
The Tooth Germ is a blog that I set up like 5 years ago now, and it is just basically a hobby. It's one of my other hobbies, but I guess it is dentistry related, so I can't really count that as a real hobby and still work.
Kind of like me in this, so I suppose, yeah.
So that's just documented to like kind of how my journey throughout my career, the things I've done, I've learnt along the way, and it's there really to kind of raise a platform for different careers as well, to think what people who want to develop their careers. I mean, I'm doing my fellowship at the moment with the Office of the Chief Dental Officer, and the amount of queries I get about how did you even find out about this? How can you work from home? You're a dentist, things like that. It's something that it's more and more prominent and more popular. People want kind of portfolio working or alternative ways of working, rather than just working in the practice 9 to 5, in the last 10 years becoming a partner, and then after 10 years becoming the practice principal. Like, that is not the career pathway for young graduates nowadays. We want a portfolio of things, we want to cut fingers in different pies.
Variety, yeah.
Exactly. So that's what a Tooth Germ really has become, a kind of platform for that. And it kind of want to instill that alternative way of thinking, and finding alternative career pathways or innovative business ideas to go with dentistry. Dentistry is not just healthcare. It's, in a lot of places, times, it's settings, practice. It's really business, and ultimately the NHS is a business, and so we need to be able to think like business people in a way that if you're running something, it needs to be cost efficient.
Yeah, because I think that's definitely something you kind of notice. You say, no, there's a lot of things which we would like to do, maybe patients might benefit from, but you only get paid a certain amount for doing something. Whatever that course of treatment, you get a certain amount, and then if you're going way over it, you're going to be out of business within weeks almost, aren't you?
Yeah, exactly. So we all like to be altruistic, but it's got to a point where you need to think of a business person.
Yeah, so you're planning on kind of moving into more kind of different little bits of things. Have you ever thought about teaching? Is that something that's on the radar at all?
Possibly. I mean, I do some teaching already, and I really enjoy it. So I teach on dental courses to help people with national recruitment. I supervise dentists and dental undergraduates at King's occasionally, and our dental core trainees as well, and it's really fun. It makes you question your own clinical thinking sometimes when you're saying, okay, this is what I would do, and it's like, actually someone's going to ask me why I do that, so I need to think about what my clinical justification is, rather than just my gut feeling or what I know works. Like, how do I know that actually works? Or, okay, I'm going to teach someone how to cannulate. Okay, why am I doing this then? Rather than it stops you from being on that autopilot all the time. Yeah. And sometimes slightly differently. I really enjoy teaching. So you never know, might be an educational supervisor one day. But you never know what happens. Like you asked me 5 years ago, I'd be like, yeah, I'll be working in a practice, and then what am I doing?
9 to 5, and then that's it. Yeah, go home. So I think that's pretty much most of the questions I had kind of in mind. We had a couple of little fun ones towards the end. So I was going to ask people what their pet peeve is, whether that's dentally related or kind of just in general life.
Pet peeve. My pet peeve is when patients decide to suddenly go, yeah, I've got this yeah, and then they go and touch the rest of your surgery.
I think
like that really annoys me. You like we had a lovely clean surgery, and then now you're just sticking your own fingers in your mouth and then throwing it over. I think we're gonna bit. That was very practice me. Like I used to be very like, if you do that in my surgery, here's some hand gel. But with my special care patients now, it's like, well, you're never going to change that.
Yeah, you definitely get the couple who are like, oh, can I have a rinse? And then they lean kind of halfway over and just drop it over the side, and it's all on the floor. And you look at the nurse, they're just going, I have to clean that up. That horrible kind of face going. The next one was, what's your favourite conspiracy theory?
Maybe I was talking about this the other day. Maybe like the moon landings didn't really happen. We were talking about that, like how much money gets sunk into like space, and trying to get there's another expedition to the moon soon, but it's going to cost like $15 billion. But imagine like if all the moon landings and everything was just all a conspiracy and it was all just in a studio somewhere, and what's that money actually being spent on?
Probably someone's holidays, isn't it?
Probably.
Yeah. No, thanks for coming on. I think that's been really good and quite insightful. I hope you guys in the live have kind of picked up on some of the things that Nat's been doing, and definitely check it out. Tooth Germ, the link's in your bio, isn't it?
Yeah.
Yeah. Thanks guys for joining us. If you've been live, if you're going to be watching back on YouTube, then get in for the next live on Instagram. We have got one quick question from Steph IB. What are the differences and advantages in working in a hospital versus a private clinic, do you think?
So a hospital, you don't really think about targets in the same way, I don't think. You might have some targets that are set with you that you have to have so many patients on a list, but your patient, whatever they present with, if they need 10 crowns or they need one filling, you're just going to do it. Whereas if you're in a private clinic, you've got the associated costs of all the equipment, and if you're self-employed, I think that's something you'd be more concerned about.
Yeah, thinking about your lab fee. Yeah.
Exactly. Also in hospital, you might feel more confident doing certain treatments. I certainly would do things a bit more out there in a hospital than I would do in my clinic, because I know I have support there, whether that be medical support or consultant support, or just the support of having clinical staff around you in a hospital. And one hospital I work with, you can be in a clinic with 20 other dentists, and you're like, well, if I need a second opinion for something, I've got so many people to ask. Whereas if you're working in a practice maybe by yourself, or only with one other dentist, or just with a hygienist or a therapist or something, your decision is final, or your skill is final. So if you start doing that extraction and you can't do it, you can't do it.
Yeah.
But if you're in a clinic where you've got support, you might be able to take on things that you might not.
Bit of a safety net there. Yeah.
Yeah, exactly. Yeah.
All right, brilliant. I think we'll call it a day there. I think we've had a good old chat. Everything that we kind of wanted to go through, gone through all the special care stuff, homeless, not so much on the commissioning, but it kind of all tied in, and gone through a bit of you and what you're about as a person as well. So yeah, thanks for coming on. Definitely follow Nat on Instagram. Get into the Tooth Germ. There's loads of articles on there that she's popped on, just saying what she's been up to. Anything else you want to plug while you're on?
No, that's about it. But if anyone has any questions, I'm happy to answer them. Or you want to reach out with me, I'm so very, very open and friendly, smiley face. So please feel free to connect. Yeah,
so I think I have to say like, comment, subscribe for those guys on YouTube, which is going to be new for me. Thanks for joining us, everyone, and we'll see you on the next one. Thank you.
Bye.